National Red Cross is teaming up with Metro Manila Mayors to build isolation wards for mild to moderate COVID patients and help decongest hospitals. We now go above and beyond with PRC Chairman Senator Richard Gordon. Senator, good evening. Please tell us, where will these isolation wards be located?
They will be located in every city. It will be designated by the mayors or by us. It will also be located in CCP, those former vaccination, rather testing centers. And we will be putting our manpower, our ambulances to bear. And what we want to do, the objective is to, testing is key. Once we've tested and we find an asymptomatic spreader in a home, in a hovel, really, he can infect everybody. That's why you have families now getting sick. So we'll pull out the asymptomatic spreader, put him 6 to a room in the schools like Ateneo, and we're preparing for Ateneo. By Thursday, it will be open. And LaSalle and UP, we're talking to UP right now as we speak, they're preparing for it. And other areas, then we can provide the necessary accoutrements like beds, food, medicine, and a watchful eye over them. And there will be a telemedicine from the PMA who will take care of anything that they may need. And if they need to go to the hospital, we'll have the ambulance take them to a particular hospital, and we're watching the hospitals. Whoever will have a vacancy, we can bring any of these people. If they turn bad, we can bring them to that hospital without too much pain.
The big question here is, why didn't we think about this yesterday? Isn't the WPH and the isolation czar building enough facilities?
Well, in fairness, Rico, they did a quarantine service. But, you know, that's only half of the problem, Rico. And that's why I would like to make sure that when we get these people out, we have enough money also to give their families who are going to be left behind, because nobody's going to be a breadwinner. And we've been doing that. Just last week, we gave 3,500 single parents food for 1 week. And we want to do this also for the people who will be left behind. That's why I'm hoping that PhilHealth will pay us the money that they owe us, so we can, do a lot more things faster and better.
Senator, our Southeast Asian neighbors have shown that they have been able to contain the infection numbers. You have Thailand, Vietnam, Laos, Singapore, Myanmar are all averaging less than 100 or in the teens in terms of infection rates. Even in the vaccination drive, we are one of the laggards. What are we doing wrong? What best practices can we learn from our Asian neighbors?
Well, I think that there is a lack of urgency in some of our bureaucrats. I think IATF is trying to do their job, especially Vince Dizon and Charlie Galvez. But, you know, it takes time to go down the roots. Kawawa naman, di naman naaabot sa soba. But I don't want to fix the blame. I want to fix the problem. That's always been my policy in life. And I think also, remember, there's the variant. And remember, bureaucracy is the #1 problem. I think the DOF should watch it. I think that the Budget and Management and COA should realize that there's a tremendous problem before us, and they should release the money quickly. And PhilHealth is the biggest culprit of all. They don't want to release the money. So hospitals are short, and and even for vaccination, there was this very, very stupid guy from PhilHealth who said, "Oh, we cannot pay those interns in the hospital because they're not part of the law." That's the kind of unmitigated stupidity that we have in our country.
Senator, we are indeed in a very critical state. So many COVID patients are flooding hospitals. The grim stories that we read on social media is truly devastating.
Definitely. The other night, a young lady, 22 years old, was in an ambulance with his father who had suffered a stroke, not even COVID. And he called me on the 12th hour of the ambulance. He had gone to Old Laguna and Cavite, and he couldn't get in. She couldn't get in. He bring her father, and she was being charged 10,000 pesos for saliva. So I told her, tell the driver, bring her to the Red Cross. We swab her. In 6 hours, we got the results. And because of that, we were able to bring her to Jose Reyes. These are the things that we have to do extra. A lot of people, when people are comfortable in their homes, there's an awful lot of people in the Red Cross that wake up, including yourself, myself, to make sure that we can help. You cannot imagine how many people have called us to bring them to hospitals as far as Clarkfield, as far as Batangas, as far as Bataan, even to Subic Bay, to make sure that we could provide hospital accommodation for people who are really, really sick. The lines, especially in the big hospitals, go from about 30 to 60 people waiting in the emergency wards. This is a disaster of tremendous proportions, and somebody's got to keep their eye on the ball. Otherwise, well, there will be perdition.
How many tests right now, Senator, is the Red Cross averaging per day?
We're averaging 15,000 a day now. Since March, we started going up every day. And we now have, the last several days, we were averaging 15,000. Our highest was 18,000. And you know, this has never happened before. And so now we have to really double time. The last several days, we hit 15,000. And that's why the saliva test is also very helpful, although they just released it today. April 1, we hit 14,000. March 31, 13,000. March 30, 14,007. And, you know, so forth and so on. They haven't gone down to 12,000 ever since.
But
So
Senator, should we be merging RT-PCR, which includes also saliva tests with antigen tests, in coming up with the total number of infections?
I strongly advise against the antigens test. I'm one of the few people who say it the way it is. Antigens is good, but it can give you a false result, and that is why the PCR test, must be done. Into an antigen test, a positive result is dependable, but a negative result needs further verification as the test is prone to false negatives. I was telling you about communication. Many of local governments are not aware of that, and they're saying, oh, saliva test ng Red Cross, hindi pinayagan yan. Pinayagan na po yan, matagal na, last January. And only March 31 did they release the guidelines na PhilHealth can now pay the Red Cross for the saliva RT-PCR. And therefore, it can be done real fast. In fact, in Bicol, I'm taking a Cessna plane starting next week to get the Bicol, because we don't have a molecular laboratory there. Our chapters, though, can test saliva, and they can bring it by plane, and within the same day, they can get it if they do it early, or the following day. Within 24 hours, they will get the results.
Thank you so much for joining us on Newsnight, Philippine Red Cross Chairman and Senator Richard Gordon.